Okay, this is my research presentation, and it is on LGBTQ plus individuals and their experience of obstetric and gynecologic mistreatment. And I'm Amelia Chandler. So my research topic is obstetric and gynecologic violence. Broadly refers to a form of gender-based violence that violates human and reproductive rights in medicine. This can include hiding information, doing intentionally painful procedures, inappropriate touching, physical and verbal abuse. I just wanted to note that some of this might just be considered medical mistreatment, that may or may not be considered obstetric and gynecologic violence. This will be included as well, because obstetric violence is a term that does not go uncontested. And if you're curious about why, there are some readings on this, such as obstetric violence is a misnomer, which with its two responses, let us name and shame obstetric violence, and obstetric violence is not a misnomer. So there's lots of debate around the title, but yeah. So my aims are to explore LGBTQ plus individuals' experiences of obstetric violence, to identify recurring meanings in their firsthand accounts of the obstetric violence using open source Reddit posts and comments, and to consider the potential health impacts that obstetric violence can cause on the individuals based on the findings. So why does this matter? It will reveal biases that medical professionals may have. This is important in caring for diverse patients. Also, lesbian, bisexual, gestational parents do have worse pregnancy outcomes, such as struggling with miscarriage, stillbirth, onset of depression during pregnancy at higher rates. And lastly, there's very little known about pregnancy outcomes of trans and non-binary parents, as well as their experiences as well. So the data collection and analysis section, comments and posts, they were sampled from reddit.com from the subreddits r/LGBT, seahorse dads, two X chromosomes, and then one from new parents. All of the relevant posts and comments were reviewed. This is because in order to gain enough insight into the experience, I had to review them all since there were limited data from the specific subgroup, just because there weren't a lot of people posting about this. So the unit of analysis is a post or a comment, and I had nine units of meaning, which were published between May 2022 and February 2026, so all fairly recent. There was one very long one, but it was very rich in information, so I made sure to kind of even that out with the shorter ones and make sure it wasn't overshadowing the whole project. And for the analytical steps, it was inductive approach of thematic analysis with all of those steps. So my first main theme is physical and emotional pain. So the experience of pain and harm, whether it was purposeful or because of lack of care, it is a trait that's congruent with the experience of gynecologic and obstetric violence. And these experiences causes pain, either physical, emotional, that could have been avoided. Even if it was lack of care, you can avoid lack of care. So the first quote is from a trans man who is recounting the harassment and trauma that he endured while in the hospital. This experience caused him to be robbed of that initial joy of having a baby, and the difficulties of giving birth were exponentially worsened by the emotional pain that was caused. Having to deal with being mocked while taking care of a newborn puts a unnecessary strain and worries on a person's body and can even increase the risk of postpartum depression, and that can cause lasting effects. Person number 6 was also a transgender man, and he was discussing how he felt when his birth did not receive the same support as his female friend did. So he was basically saying that the emotional damage and trauma causes special times in one's life to be spoiled. Imagine if your happiest time was taken away because of who you are. The parent must deal with all of these negative feelings while gaining huge new responsibility, and that can delay processing of emotions. And also, you're not going to be bonding with your baby as much as you really should be. Again, relating to person 4, on the physical pain side of the theme, participants had very scary experiences with medical procedures and painful examinations. Even though the birth process generally is quite painful, even when it goes as planned, nobody should be subject to unnecessary painful procedures. Person number 8, who is asexual, they tell of their encounter while getting an internal pelvic ultrasound. So they were subject to unnecessary pain because the doctor did not listen to or believe what they had to say. These painful experiences, whether physical or emotional, have damage on the bodies of those who are subject to the pain. Due to their identity, they were intentionally harmed or ignored because of biases and hatred. And the main theme also ties into one of my overarching themes, which is too traumatized to go back. When people have these adverse and scary experiences, there's a clear reason why they might not want to go back to the doctor in general or that same place, when they know the same thing could quite possibly happen again. This can also have severe harmful effects on the health of the patients, as putting off getting help worsens outcomes and quality of life, not just for obstetrics and gynecology, but just health in general. The second overarching theme is identity in question. So being a person who's part of the LGBTQ plus community or any marginalized group brings yourself and your identity into question. This causes individuals to not receive the proper care that they should get due to the providers not believing or understanding them as a whole. Identity can be misunderstood, not believed, and rejected when an individual does not fit the type of person that one would expect in a space, often as a man in a hospital bed giving birth, which were a lot of my participants' experiences and identities. So, person one and person nine, they were both lesbians. I had a quote from person one, but they both experienced this in the form of having religion kind of like thrown in their face or like tried to be pushed on them, and that it was meant a way to look down on them. They are outside of what many people expect, which makes them seen as deviating from the norm or abnormal. Often people will use religion to show their disapproval as an attempt to conform somebody to their ideas of how a person should be. So, they kind of are like pushing their ideas on an individual because they think maybe they will want to be more like them. So person number three is a transgender man. Many participants actually say how they are not believed about their sexual orientation or gender identity. This can come through as misgendering. When misgendering somebody, their identity is questioned and it's determined that it's not the truth and they don't believe them. So the wrong pronouns and name are used. So such as calling someone their dead name, as in person three. Maybe it's the situation of giving birth that's so heavily gendered in society, or a general intolerance of transgender people, but it's most likely a combination of the two. And then we have person one. So she's a lesbian and she was discussing Accutane with her nurses. When you go on Accutane, you cannot get pregnant under any circumstances. So you either have to pledge abstinence or go on birth control. Um, so through not believing that she would not want to have sex with men, they questioned her identity and do not trust what she says. This creates a rift between the patient and provider when you don't trust each other, and that's really difficult to bridge together after that. When there's this incongruency between two people, there will be more misunderstanding and tension, and therefore it can possibly worsen medical care because if you don't trust your doctor and they don't trust you, nothing's going to get done. And then at that bottom, I also included some interesting quotes from Sarah Ahmed's Living a Feminist Life. This discusses the topic of being in question as a person, as a minority, and the way that the world does not conform to you. That's on the right. And then on the left, we have two quotes on having to advocate for yourself or proper pronoun and name use as a transgender person. So this is the discussion of the findings. So for my research aims in exploring LGBTQ plus individuals' experiences of obstetric violence, insights into what the recurring meanings and the firsthand accounts were, and the potential physical and psychological health impacts were analyzed. So the recurring meanings help with understanding why patients have fears on disclosing their sexual orientation to the OBGYN. And this allows for work to be done to make patients feel safer to speak up. In some of the previous research, it was citing like the percents of people that would like come out to their doctors, which is quite important, especially in gynecology, and it was like 20% or something. I don't remember the exact percentage, but I think it was about 20%. So the themes bring to light how people feel like going to the OBGYN can pose a risk to their physical and mental well-being because of the pain and trauma that they endured. And they could also think that it's just straight up a waste of time because of the denial of care and neglect that they faced. So many people, specifically like some of the lesbian patients, they were turned away for things like a pap smear. So that's not good because pap smears screen for cancer, and if you're not screened for cancer, that's not good. And even if you are a lesbian, you can still get cancer. So yeah. Um, how having your identity in question, this ties so closely with the negative experiences. And this is kind of a relatively new finding in the research, and it can be used to explain quite a lot, such as their identity not being believed, not having proper information for the specific person, denial of care, and misgendering. So, based on the existing knowledge, like some of the studies did have similar findings, but they did not focus on LGBTQ people, or some of them just didn't really specify. So, even if there likely were LGBTQ plus patients, their perspective, like their specific perspective, wasn't really the focus, which is very important. Or they had important statistics, but this doesn't go into the experience of their narratives. So, such as the percentage that I had on like who felt safe coming out to their doctor or disclosing their gender identity. or if they ever disclose their identity. The new research is very valuable to feminist research because of the intersectionality perspective. It's an important to understand how identity, power, and privilege interact with one another. Then, where I would go with future recommendations, I would really like to amplify the voices of the transgender dads, because the subreddit was very heavy with new information, and it's a perspective that even personally I have rarely heard, and I think it's very important because it's not something that's studied a lot. Diving deeper into the r/Seahorse Dads subreddit would be very helpful. Yeah, it would provide a lot of insight into their experiences, even if it wasn't just based on violence and mistreatment, but their broader birth circumstances. Especially, there's a lot of information that I found on their experience of gender dysphoria and how that impacted the decisions they made, the care they received, how they felt about being pregnant in general. And I think that would be very important for healthcare providers to understand because there are a lot of instances where they weren't kind about it, they didn't understand at all. And then I also think that interview data may be a way to draw out consistent information from different participants. Even though specific questions may not show like what's authentically important to that person because of how it guides what they are asking. So it's kind of what the research may seem as valuable. But hearing about their experiences and being able to ask follow-up questions based on that could provide more clear data because some of the Reddit posts, since they were already finalized, what the participant had said was all that there was, and pieces of what happened during their experience could be a bit up in the air or unclear. So I just wanted to finish off with kind of showing some of the voices that were in this research project because they're very important. And research on the topic of LGBTQ plus individuals' experiences provides new understanding of queer people in healthcare. And a new understanding may help shrink the gap in health disparities of the LGBTQ plus community. So thank you for listening.